I call this session to order, and will you all please join me in the Pledge to Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Are there any changes to the agenda?
One.
Okay.
I am asking that we add the resignation of Kelly Marcotte effective June 30, 2020.
Okay. Thanks. All right. We don't need to vote on it, do we, Charlie? No. Okay. Public comments.
So I'm going to put up the public comment policy on the screen for those in person and remote to be able to see. So please make sure that you familiarize yourself with this policy before making a public comment. We do have both a digital and a physical audience tonight. So those physical, obviously I'll hand you a microphone. You can make your public comment that way. Those remote, you can do so by clicking raise hand, which can be found at the bottom of your screen. And by doing that, I can acknowledge you so that you can make a public comment. And before making any public comment, if you could just give me your first name, your last name, and your town of residence, that would be greatly appreciated.
Yes.
So we do have an in-person that would like to make a comment.
Good evening. My name is Ann Claude. I'm a Jaffrey resident with 3 students in the district. Thanksgiving of 2019, before COVID was a thing, our daughter got sick. High fevers that would not break despite meds. We were in daily contact with pediatrics, an ED visit for testing, fluids, anti-nausea meds. It was the morning she woke up with bright red eyes, not bloodshot, but the entire whites of her eyes were red. We were met by 2 pediatricians in the ED who were concerned about Kawasaki disease, and she was promptly sent up to Dartmouth. She was quickly swarmed for interventions, and they changed her antibiotic 3 more times. She was still spiking fevers, and she was so sick and tired of being sick and tired that she tried to get Daddy to take her home against medical advice. The next day, she had surgery. Fevers finally broke and we were able to go home. This was before COVID was a thing. But as talk of pediatrics cases came out, her symptoms seemed to fit the bill. It was horrible to watch her be so sick, so we are cautious. To minimize risk for our kids, we remote schooled all of last year, and I was very nervous about sending them back in person without a mask mandate in place, especially the youngest who are not eligible for the vaccine. But after talking with our pediatrician, they're in person with their mask upgraded to KN95s. We're all vaccinated and we still wear a mask when we're out in public. I don't just speak as a parent. I'm an inpatient medical social worker, and I have been for over 14 years. I see COVID in the hospital every day. People come to this meeting and they talk about death rates for and against the matrix and masking. But I support families when people die, but it's not just the death rates that matter. I help patients move through the continuum of care. When the talk is what supports and equipment they need to go home, or if they need rehab before getting strong to get stronger before. One young patient, the day after she was going to inpatient, one young patient, after being in ICU for more than 20 days, wanted to celebrate that she had moved from the bed to the commode and was able to wipe herself. It was great progress. She told me about not being able to move her arms after she'd been taken off the breathing machine and worried if she would be able to get her function back. I send people home with oxygen who didn't need it before and hope I can find them nursing care to support this new need. It's hard and it's getting harder. And it's frustrating when people don't take steps to minimize their risk or level of illness. Please wear your mask. Please have your children wear their mask. Please get vaccinated and have your kids vaccinated. And I support increased masking in our schools.
Thank you, Anne.
Hi, Nick, this is Lisa. Can you hear me?
Yes, we can.
It looks like the other groups on Zoom are getting an echo. As a panelist, I have no echo on our side, but there might be, it's making it hard for the others to hear apparently.
Yeah, unfortunately, at this time, I only have one report of an echo with dozens of people on. So I'm a little lost as to how to be able to fix it. My advice would be to potentially log out and try to log back in and go from there. Yeah, I have another person saying no echo on my end. So unfortunately, at this point, it's an isolated case. So I would encourage that person to try to log out, log back in and see if that helps. It could also be a system issue with speakers or something to that effect.
There could be two people in that household trying to log in on separate devices as well.
Yeah, and if there's two, yeah, as Marcia said, if there's two people in the same house, close in proximity, trying to listen on the same device, that could be a potential as well. Yeah, I would just recommend if people are having issues right now to log out, go back in. Obviously, if we get more reports, we can address it from there.
Yeah. I'm Sheila Nagel. I'm a Jaffrey resident. Sorry, I came running in here late. I was at basketball practice. I actually came exact opposite of what she's saying. I was kind of looking at online. You guys posted like the survey results and what you guys are proposing, or I don't know who posted this, what the proposed changes are. I know the CDC just changed it back to a 5-day quarantine versus a 10. And you guys were saying if we implement that, you guys suggest masking all the children for at least a month while we figure that out. I'm 100% opposed to that. I'm more concerned about the mental well-being of our children. All the studies have shown the mental impact of it. Even when we did this last year. Sorry. We all saw, I personally saw, well, on Zoom, kids being very depressed. I'm very concerned about the impact this has on our children. I do not want to see my kids forced to wear a mask. I'm 100% on board. If somebody's sick, they don't come to school. I always have been, even pre-COVID. If you're sick, stay home. I don't think we've really seen many clusters. We have a huge influx right now. I just got the email. I think we have 36 cases. None are related to school. They didn't come from school. They weren't spread at school. That was all outside stuff. So even if we implemented this mask mandate, it would not have affected that whole outcome. And as we've seen in the past, our kids are not the high risk group. They're not the ones that we need to be worried about right now. I do not feel we should be masking them. I don't think that, I think we should leave it the same if we're going to have to implement everybody wearing a mask. And that's all I have to say. And on a side note, being in the school, that's the biggest issue I have when we go to masks. I'm constantly arguing, I'm against masking, but I have to argue with these kids to put their masks on, put them on correctly. And it's nonsense disciplines, I feel. My personal kids get in trouble for it, and I'm disciplining kids for doing it. I'd like to not see that in our schools.
Thank you, Sheila.
All right, so we had two people in audience physically, and they've both had a chance to speak. So at this point, we do have one person in the remote audience. Sarah Graham.
Hi, can you hear me?
Yes, we can. Thank you.
My name is Sarah Graham. I'm a Ringe resident and a parent of a student in district, as well as a teacher at the middle high school. I'm asking the board to reconsider a mask mandate. With cases numbers on the rise, both in our community and in schools, I feel like this is an important step we can take right now to help keep our learners and our staff safe. Thank you.
Thank you, Sarah.
All right, then we have one more that's popped up. So
Okay.
that's that one.
Yep.
Jennifer Clark.
Hi, can you hear me okay?
Yeah, the volume's a little scratchy, but
Okay, so with the rising number, I'm very concerned with the number of cases, whether they be out of school or in school. There are people bringing it into school. My issue is everybody should be wearing a mask right now. That's my own opinion. And after watching the news tonight, I strongly feel that's my opinion now. I'm really done with using my child as a guinea pig. If the school is not going to implement masks, or the school is not going to try to do anything as far as deep cleaning the school, I feel like there should be another option for schooling, because right now all I can do is send my child to public school. I have no other option. I have no option to homeschool her at this point, because that is not an option. So my child is at risk. Every day I send her to school, she is at risk of getting COVID, even being vaccinated. I think there should be a serious discussion going on tonight as far as what the school district is doing regarding more safety precautions as the numbers keep rising.
thank you, Jennifer. Have any more hands popped up there?
All right, that is all the people that we have for public comments.
Okay.
Just to let everybody know that's in attendance, we do have a second public comment section at the end of the meeting, or toward the end.
Okay. Thanks. Okay, we're on now to the superintendent's report.
All right, well, I hope everyone had a nice break, and it's good to be back. And I apologize for not being able to be there this evening in person, but it's good to be here in the totality with all the board members. So tonight's superintendent report will be similar to ones that we've had in the past, where we focus on one of the more in-your-face kind of conversations, which we've even had public comment on tonight, which is COVID. And so we want to make certain that am I heard? Do people hear me okay?
Yes.
Okay. All right. So I just wanted to make certain that we were continuing to follow the patterns, follow the data, have conversations. There have been changes that have happened recently having to do with CDC, not necessarily changes with New Hampshire DHHS. It's a hot topic in this area. It's a hot topic across the country. And I think we, like last year, we were very good about making adjustments when we needed to make adjustments. And I do have some suggestions for some adjustments, at least some considerations. So to clarify some things that were stated earlier, the board has not put anything forward saying that they want to do one thing or another. It's a matter of me coming at this point in time, which I've done every single session that we've had, providing information, providing updates, and to pose questions about how to do things the best we possibly can for the betterment of our community. We looked at the survey briefly last time, some of the survey results. I have kept a couple of those items in and then looked at a couple of the other questions a little more deeply, so provided some other points of view just from some of the conversation that we had. Again, only 300 family responses out of the 1,250 kids we have, so out of the 800 or so families that we have. But it's about 30%. It's not a terrible percentage, but it's not always what you want to be using as a tool for all of your decisions. That being said, the people who are interested in the topic of the survey are most likely the ones who are going to be answering on this survey, in either direction. So demographic again, over 55% were from Ringe, from families, and 43% from Jaffrey. We did have some other parents who were from other areas. If we could move to the next, yeah, thank you. And in those family results, we saw that there were about 20% who wanted to permanently add some mitigation measures. If we went back to the qualitative information, we would see that the majority of them were talking about masks. We did have, that was the number one by far ask to add, and to do that permanently throughout the rest of the year. There was another 25% who indicated that they wanted us to do that, but temporarily, like, hey, we've kind of been okay with how things are going, but we're concerned with the direction that the rates are going and the numbers in our schools and things of that nature. And so maybe a temporary addition would be good. And we have another quarter of the individuals who say, let's return to normal, let's scrap the whole plan. And then we have about 30% who said, 31% saying, let's keep things as they are. So about a third. We also surveyed staff, similar survey. And this is important because we talk about what's happening. We're going to see some of the breakdown from Ringe and from Jaffrey, because it's important, I think, to look at both of those as well. But also the individuals who are working. Yes, I reported 36 new cases today. Obviously, it wasn't from internal spread to the school, through the school, because we didn't have school over the past 8-9 days. However, we do have an impact, because out of that 36 are between 6 and 8 staff members. Now 6 of them maybe with COVID, but 2 more staff members impacted as a result of that. And so when you have a decrease in staff members, when you already have a crunch in the population of adults that are able to be here and be present and work with our kids on a continuous basis. And our teachers are super dedicated. Our support staff is super dedicated, doing an amazing job this year. And we have functioned so well. That being the case, it wears everyone down, and we get closer and closer to not being able to do what we need to do. So again, one of these goals is to keep kids in school and keep kids in person, because the social emotional well-being is so crucial, and we know that. We don't need to go in to discuss that again or look at any of that data as to why that's the case. But we need to be thinking about making the best decisions for staying within school during this time frame, and what can we do to make sure that we're not risking it. So I looked at some comments about masks within the survey by town, so by Jaffrey and by Ringe. And so out of the 160 individuals who did respond in survey one way or the other, a lot of them, most of them in yellow, didn't respond with any sort of qualitative feedback at all, whether to take anything away or add anything. Individuals in blue, you had about 40 to 45 from Ringe and about maybe 50 from Jaffrey, who stated that please add the masks. Again, we don't know completely what the yellow means. They may have been anti-masking. Some of them probably are, maybe even more. Most of them are. Some of them probably pro, but at least the people who wanted to let you know when given the opportunity, it was a smaller group of individuals who were saying they were against it, and more in those towns saying that they were for it. That being said, you can go back to the slide and see that the family results show that over half want things to either be normal or kept as is currently. And then the comfort with the reopening framework and strategies. Again, this was just another look at it. Jaffrey and Ringe You had a group of people in blue saying, let's keep it current. In red, let's change it current, the current status, meaning the change would be, let's do something in a way that is a little more extensive, either temporarily or permanently. And then the yellow was remove all or part of it, which is about a whole third of the Ringe population and about 25% or 20% of the Jaffrey population there. So when you look at things like this, you can see that there's a little more balance, I guess is what I'm trying to say. Sometimes our conversations pit town against town, and I think that this shows that it's a little more balanced in each town, actually. Whether it be for or against, we have some balanced communities. Now, going back, our teachers are about 75% asking for either, I should say, not just teachers. Go back to that one staff. So teachers are in that number. It's custodians, SAU, teachers, instructional associates, secretaries, clerical aides, etc. A number of individuals, guidance counselors. There's a variety of topical areas, kind of categories there. But people who work for the district, who are employed by the district, had the opportunity, and we had a much higher percentage of people responding to that one, comparatively speaking. And about 75% are saying at least temporarily add, if not permanently add. But you got that. And I think that's something to look and take into consideration. This was alluded to earlier with a public comment. Yeah, we look at the data. It is sobering to have kind of cold conversations when looking at numbers. Unfortunately, when I present, it's the easiest way to not get emotional about something is to show just the numbers and the facts that are out there. And so we do have a change, as you had seen on WMUR, that there was one death that was reported, I believe, back actually from September. But New Hampshire, in that 0 to 9 year age, we don't know a lot about the situation, but that number has changed. A lot of the other numbers haven't changed. There are some articles out there indicating that younger children are becoming more hospitalized at a higher rate. I don't have a lot of hard evidence on that or data. I do know that from friends who work in the medical field and just the information that we read in mainly the Sentinel, the Keene Sentinel, saying that it's pretty significant, the number of individuals who are in the hospitals over in our area, especially in the Cheshire County. But if we look over to the right of this one, you can see that, as we talked about before, just from a math standpoint, you can see some typical trends. We actually predicted that we'd see this type of a picture because it was going to mimic the last picture, but just be about double the height. And so there are some trends that are happening, or at least they're staying with what we had thought would be the case, which means it's going to stay up there for a little bit, for maybe another month. This is something I share every single time. Vaccination percentages were very low in the area. If they do creep up by 1/10 or 0.2% every single time that we talk here, certainly vaccination, the definition of being vaccinated is different than it used to be. It was, you had your Pfizer 1 and your Pfizer 2, or your Moderna, or your one, J&J. And then it became, after a certain amount of time, you have your booster. And if you didn't have your booster, then, that the protection isn't there, and so forth. So this, I believe, still takes into consideration just the original shots. Changes. So everyone heard about CDC guidance and how they made some adjustments, and they made them faster, and New Hampshire DHHS didn't know anything about them. And so we got this email today. This is just from the body of the email. I got it from a member of the New Hampshire Department of Education. And just the email reads, state public health officials have reviewed the press statement issued by the CDC regarding isolation and quarantine and look forward to receiving the CDC's complete guidance once it's published. Once official guidance is available, the state will be able to determine how best to implement these changes in New Hampshire for the general public and in settings such as healthcare, residential facilities, and schools. At this time, residents should continue to follow New Hampshire's current isolation guidance and quarantine guidance, and then changes to the state's guidance will be based on the CDC's full recommendations and will be updated, I would hope, within the week, but we don't have a time frame on that. So the recommendation here is to sit tight and not go with the CDC right away without knowing what the DHHS. Now, we have chosen to go along so far with the kind of the flow chart of the DHHS of how we do quarantining. So in one sense, if DHHS changed everything to what CDC says, we could simply just go along with that because we've already kind of made that adjustment, or we could do something different, or we could, you know, make adjustments now if we wanted to. These, I just took these right off of the CDC website. I retrieved that today. You can see the website down below, because this is a copy and paste. And that if you test positive for COVID, these are the ideas. Everyone, regardless of vaccination status, would stay home for 5 days. You're supposed to be in isolation during that time frame. If you don't have symptoms resolved after 5 days, you can leave your house, but continue to wear your mask for 5 additional days. Going to the next slide. I mean, there's fever elements in here as well. And if you've been boosted, and then if you haven't been, you know, if you're not vaccinated or you haven't been boosted, here are the other approaches to take. Some of them are just suggestions. They're not really hard, like do this, must do this type of situation. They ask you, if possible, test on the 5th day. If you can't quarantine, you know, way on the bottom, you know, wear a mask for an additional 10 days. And so you can see our community's vaccination status, and that complicates matters if we were to go into a situation such like this, where we have, like, if you are vaccinated, this is how we would approach it. If you are vaccinated and boosted, this is how you approach it. If you're, you know, haven't been boosted, or if you haven't been vaccinated, this is how you would approach it. And then, you know, having to get vaccination cards and so forth. There are a lot of things to consider around this. And so whatever we do going forward, we need to make sure that it's implementable, and that we're doing things that are going to be beneficial to the whole, and not harming our teaching and nursing staff. Our nurses work incredibly hard. They receive a lot of tough comments at times, and they handle things very gracefully. And I know it's a difficult situation, and there are a lot of viewpoints. It's never okay to be unkind. And I am glad that our nurses have really been able to step back and understand where people's stresses are. But it's you can imagine now trying to figure out whether you were going to have to hunt someone down to see if they were still wearing a mask 5 days after they returned while they were vaccinated, and then someone else who was unvaccinated, making sure that individual is wearing a mask for 10 days and so forth. It would just, I mean, who's going to be able to do that? Do we have their names written down somewhere? I mean, it's not manageable. So whatever we do, we need to make sure things are manageable. So I do have some suggestions. Again, some of these we already have in place. One of these we already have in place, and it's for the purpose of making things manageable, for the purpose of allowing our administration to be able to enforce the rules that we have agreed to and that we've set forth. I think it's a shame that I'm even coming here and asking for this to be put into a framework. I don't think it needs to be. I think we already have some policy that governs this, but maybe it's a little bit unclear. Maybe we need to be clearer. I think that whenever the principal of the school or the athletic director or the activities director of a school indicates that there's no eating in the gymnasium while a basketball game's going on, that we're not going to have fighting from families or parents. If we ask people to have a mask on, and that's the rules, and those are how things are to be, so that we can actually have games and visitors come to our games and for our kids to play, I think that's a reasonable request and something that we don't need to have arguments. And I don't need to have people arguing with my principal about and saying that they don't need to wear their mask over their nose. That's nuts. So that needs to stop. And I want to make sure that we have whatever rules we need to have in place in order to make sure that that ceases. The arguments, we're here for kids. We're here to make sure that they are able to get the best experience they possibly can. We need to keep them safe. We need to be able to keep other people safe at the same time. And some of it's not, and some of it's just practicality. Some of it's not safety. Some of it's a matter of, some people won't get sick. People get sick. Most people who get sick are not going to have significant difficulties or problems. But you know what? If they're kids, they're out of school for a period of time. If they're families or parents, they're out of work for a period of time. And there are repercussions and there are domino effects. And we have to take that in consideration. And so even though we currently have no eating and drinking in the Pratt, it's been a concern. It's been brought up by several people. I don't, I understand why people want to be able to do that. They're not unreasonable reasons for wanting to do that, but it makes it very difficult for our administration to be able to enforce a mask situation when someone can have a mug of coffee or some chips or something like that and have that open the entire time with their masks down. That's not kind of how it goes. Number two, and I have a kind of part A and part B. I guess I got 2 and 2A. Should have been 2A and 2B, but that's okay. If we do adopt a process more in line with the CD guidelines, we have to make it such that it is implementable. And so it is why I have put down considering masking for all if that goes in place. At least for a period of time. We've talked about data. I definitely want to see data. We do know that last year we masked and we had very good data results. Now, I understand there are other schools that have masked and haven't had good results, and there are other schools that have masked and have had very good results. We might be one of those schools that if we mask, we get some good results. And during the month of January, where we still are going to have some high numbers and where we're ending out the quarter, where we don't need to have kids absent due to illness and teachers not being able to be here because of quarantining or isolation, do we take this time to collect some data? I think it's reasonable to do for a month, to think about whether, hey, during the month of January, during the rest of this semester, basically, say, hey, let's take some data points. Let's find out, am I going to be reporting after about a week or so? Am I going to be reporting fewer than 4 cases on average a day? Because over the last 2 months, and I mean, even during the time frame that I just reported, it was averaging out a little bit above that. We have 4 to 5 a day. Now, if it continues to be that, then I would say it's probably not doing a whole lot. But if we're starting to report 1 or 2 a day, that's a big difference during a time where we know the transmission is going to be high and maybe even higher due to the emergence of a different, more transmissible variant. So those are just some things for us to consider. I apologize for getting a little heated earlier on. Our staff needs to be able to do what they need to do and needs to be able to do what's best for our kids. And that's why we're here.
All right, thank you, Ruben. Questions, comments? And I apologize, Patty and Lisa, you just need to yell out because I can't see you to know that you want to speak?
I can see them, Marcia, on one of my
Okay.
screens. So in the worst case, if either Patty or Lisa just wanted to try to give me a wave to start, and obviously if I don't see it, then we can go from there. But
Okay, all right.
Where it showed the survey though? Like how, what people was it over half that they didn't want the changes? I think it's, I think it was.
It was about 54%.
you talking about this one?
Family.
Yeah. Yeah, so over half. Thank you.
Christine.
I'll start it off. So we've gone from, it's like watching, never mind, I won't say that. We've gone from COVID to Delta to this new variant, Omicron, and we've seen the case load go up significantly with each new variant that's hit us. Now, I believe we're dealing with Delta and Omicron at the same time. I understand that the case is being made that our students are not getting very sick from this. And while there's an increase in kids going to the hospital, it's not significant. However, missing 2 weeks of school is
Significant.
a lot. Missing 2 weeks of school while grades are closing is a lot. The fact that our hospitals are overrun, that people can't get in for routine care, that's a lot. I mean, that's, in my opinion, we have a responsibility to keep our kids safe and to keep our teachers safe, even if they're just testing positive and they're not getting symptoms, they can't come back to school for a week or 2 weeks. Our staff is stretched to the max, stressed to the max. And, our students can't learn new things if they're sitting in the library
With no
playing games
teacher.
on their computers.
Yep.
So I have great respect for the committee that gathered to come up with a framework. These variants were not anticipated when the framework was considered, and I believe it's time to act and to change.
I think you guys also gotta keep in mind though.
It's
that
not
you
your turn, not your
No,
turn.
you were
No,
going
Sheila,
there,
is not your
it's
turn.
not.
Sheila, it's not your turn. Sheila, it's not your
I'm
turn.
giving you my opinion.
I'm
You
not-
guys are voting.
Public comments is when you do that. This is a meeting of us.
You represent me.
You're observing.
I'm a taxpayer.
You're
You
observing.
represent me.
You're observing. John, comment? Okay.
No.
Charlie?
Yeah, I guess where I'm at is we've already, first, we don't have any numbers that are different day one than what we had, back in December. And at that point in time, we had said, okay, we give the principals the authority to require masking when they have a cluster or they have a staff issue, okay, for at least 5 days, and to extend that if they needed to. And the results of that, according to Ruben's data, was that it did show some perhaps correlation. But at this point in time, I don't know that there's enough cases to make it worthwhile to go to a full school-wide mandate for masks. I think we've got something in place now that allows us to collect data and go from there. Now, one of the things that I'm concerned about is we talk about masking in school, and the purpose there is to prevent transmission in the school. But I just heard someone say that school doesn't have a bunch of clusters and we're not transmitting it in school. So the idea of masking in school to prevent transmission, if we're not having transmission already, I'm kind of confused as to what that really means. So I guess I'm not convinced that going to mandated masking for a month or a quarter or even a few weeks, okay, is warranted unless because we already have the capability to deal with that. We have principals, and if all the principals say, hey, look, the situation is impossible here, I need to go to full masking, and they do that, then it will come for the board for review, and we'll understand because we'll have the data. I mean, they don't make decisions on a whim. They do it because they have reasons to do it.
Mhm.
And they can bring those reasons to the board, and if we agree with those reasons, we say, yeah, keep going. But I'm trying to to balance here between what's the right thing to do and to implement masking where it makes sense to do that. Okay,
Mhm.
that's kind of where I'm at right now.
Okay. Thank you. Alicia, you have thoughts or comments right now?
Yeah, I guess I'll start just with saying that I'm hopeful that the new recommendation from the CDC will be a topic of conversation in the future. I understand right now that the state is directing schools to continue with their existing practices, so I understand that I'm looking forward to updates from the state. Mostly so that we can ensure our kids can be in school, especially when they're not sick. So I guess to add to that, I'd like to suggest in the meantime that we maybe consider revising our existing framework to allow for I think Ruben briefly mentioned the 5-day test following exposure. Have some personal experience with kids being in quarantine for what has ended up being an extended period of time. And even 2 or 3 days adds up over time. So I think that, the more choices we can give people, the more choices we can give children along the lines of having them in school, the better. I agree with Charlie in the sense that I don't feel like I have enough data today to support a school-wide mask mandate. We have a procedure in place that has worked till now, and I feel like we need to allow that procedure to continue working and reevaluate as the building administrators are bringing information our way.
Thank you. Patty, any thoughts or comments at this time?
Hi, thanks. And I apologize if my dogs have an opinion as well tonight. Live Zoom. I agree with Charlie, and I felt that way a week ago or whenever that was we met last about this. And I feel as though the administrators need to take action given the data that they got today, though those children haven't been in the schools. And I still really want to see the impacts of the staffing and have that be a part of the matrix. I just really feel like that's key. I'm not opposed to the masking for the month of January. I understand the struggle that everyone is having, and I'm concerned that people are underreporting. So that's that is. I don't want to send any of this underground in any way. And I hope that parents who can have their, send their kids to school with masks so that the kids are protected from each other and can protect the teachers. So we're in a very difficult position. And we've been a part of it for 20 months and it's not getting any easier. It's just getting harder.
Yep. All right. Thank you, Patty. Lisa?
Yeah, so I'm not, a couple of pieces. One, the underreporting that Patty just mentioned is accurate. the numbers, and it can be really hard as we see these numbers that Ruben's putting on the screen. The number of positive cases, of active cases in our towns is not accurate, because we are getting home tests now and you don't have to report those. And I know of 3 in Ringe that are positive that were not reported. Reporting a home test is actually a pretty convoluted process, and you do surveys and put in lots of information. And why bother? You know, you're positive, there you go. So now we have home tests, and these numbers are not going to be accurate. The second piece that is, I'm confused as to why anybody would think that the 36 active cases have no relation to what happened in school December 22nd and 23rd, because I know from experience that that's exactly when our family got COVID. And we were able to track it very clearly to that Monday and Tuesday of school in Jaffrey Ringe. So I don't know why people would think that that wasn't the case. If you get a positive test on December 26th, then we're in, 4 days before you were in school, that's probably when you got it. And then you spread it to everybody else, and trickle effects, a lot of people get out of work. For the suggested framework changes, I would definitely like to make a motion that we adopt language to remind people of our current policies about food and drink in the prep. Excuse me. And I would also like to make a motion that we mask during the month of January to collect data and discuss if we should continue in February. But I believe that we need universal masking effective immediately.
Okay, so in this discussion, you just made 2 motions.
I did.
Okay, so I want to make sure, first of all, Nick gets language, because we need to take a vote. So Nick, the first one, did you get the?
Yeah, I have them as 2 separate motions right now, if that is correct.
Okay. So the first one was, could you say it again, Lisa, so I make sure I have it right?
Yeah,
about
maybe, yep, maybe Alicia can help with this, but to add messaging in the framework, to add a reminder of our current policies about eating and drinking in the Pratt, to enforce the mask mandate that we have for athletics, so that we don't have any hassling happening.
Okay, so in the framework, we should be referencing our current policy that gives administration authority to determine whether or not there's food or drink. Yes?
Yes.
Okay. Okay. So that's the first motion. Is there a second?
So I'll second that motion.
Okay, John second that motion.
You got the policy number.
Yeah, so the policies are facilities use policy, and it is KF-R.
So we should make a motion around using that policy number.
Okay, so can we amend that policy, Lisa? Or not the policy, the motion, pardon me, to reflect the policy, which is numbered KF-R.
Of course.
All right, and John,
And I'm seconding.
you're
that, yes.
seconding that?
Yes.
Okay. So because we have some people who are remote, we have to do roll call vote. So Patty.
Aye.
Thank you. Lisa.
Aye.
Thank you. John.
Aye.
Thank you. Christine.
Aye.
Thank you. Charlie.
Aye.
Thank you. Alicia.
Yes.
And I say aye. So that passes 7-0-0. Is there any further discussion on that point?
Further discussion on.
On anything that was just said?
we're good with that, right? Okay.
Motion already passed.
It's
so.
passed, so. All right, sorry, I've got my things backwards. All right. So that was the first one. The second motion, Lisa, was
To require universal masking effective immediately for the month of January for the purposes of collecting data, and to revisit this at a school board meeting, the next school board meeting in February, the 1st of February.
okay. Is there a second for that?
Yes, I'll second that.
John, you'll
I'll
second that?
motion.
Okay. Is there any other discussion at this point? All right,
I have a question.
Christy.
Would it be more feasible to amend the framework so that masking is required instead of at 20% absentee rate, we drop it down to 10%? I think that would have put us in masks. I can't remember all the data, but we would have been in masks more times and less likely to, I believe, get to the point of clusters in the classrooms. I understand that our principals can require masks if they feel that staffing is stressed or that there's a cluster. But I am wondering if we reduce the percentage down to 10%, we provide more support to our principals to get kids in masks maybe more quickly. That's my proposal. I wonder what people think about that.
Right, so-
Hear a lot of support for the mandatory masks.
Right. Do we call for an amendment?
Well, I think you gotta, two things. I think you gotta vote on the one you got, unless the person who made the motion wants to.
Amends it.
But so you might have to vote, do that, and then if it, anyway, go through that whole process. But I will say that when we looked at that information last, I mean, it's hard to look at a week or 2 weeks of data and say that you have trends. It seemed like when we masked last time, when I showed, you saw some drops, but you saw the drops in 3 out of 4 of the schools. One of them didn't have a trend whatsoever. The other piece was you did see that when did you typically have your clusters in those schools? They did correspond. Again, we can't show causation, but they did kind of correspond at the same times that they were around that 10%, 9% mark of total illness. So it's an interesting bit of information.
Okay.
If I may, I do not want to, I do not wish to amend the motion that I made. Let's definitely, if it does not pass, let's definitely discuss Christine's idea. Absolutely. I gotta tell you, my feeling is to say, let's leave this to the principals. They're amazing, but it's really been brought home to me this week how much of a responsibility we have as a board, and how much they do look to our authority as far as making policy and making decisions. And I can't help but think about last spring when we kept looking to the DOE and to Frank Edelblut and the governor to say, what do we do? And they said, you guys make this call. And how incredibly disheartening that was to be told, you know what, our hands are washed of this. We're done. We're tired of COVID. Our hands are done. And, you know, we have a massive responsibility, and masking is the least we can do. Why aren't we doing everything possible this is such a small ask, and it won't fix everything at all. But why aren't we doing everything in our power? So no, I don't want to amend this. I would like to put it to the vote and move on to further discussion for other things.
Okay. All right.
I have a question.
Sure.
So
She's muted.
sorry, got it. Okay, thank you. I thought I did it, but I guess I didn't. The Porter, shush. What data? I just want to have a little bit of clarity on the data that's going to get collected or the data that's suggested. So if you could help me with that, that would be really great.
Ruben, I think that's a you.
Well, I think it's the data that we've been, doing. One, data on what do our total illness rates, hover at, or do they just continue to show the same pattern? Or and how often am I reporting cases? Does does my reporting, especially now during a time where we know that things are high, and the likelihood of reporting a minimum of 4 to 5 a day is going to, some days 2, some days 9, right? That's kind of been the trend over the past month or so, month and a half. Knowing that we're indoors, it's cold, let's see, will that reporting go down? Maybe, will there be a day that I won't report, but will the average during the week go down? And if it may seem insignificant, that, say I have 5 fewer cases within a week, but that's more than, I can promise you, that's more than 5 individuals who are not having to quarantine for school purposes. Because for every case we have families, they're having to kids are double quarantining. They're not, what I mean by double quarantining, 2 kids at one time quarantining at the exact same time, exactly. Overlapping, and then usually one getting sick as a result and then staying out as well. And maybe we have fewer, our staff, most of them by and large wear masks, they do. And that's good for them because they care about everyone else that's around them, so that they are, because they're talking a lot and around, and so that's very important. But it's not always reciprocated, and so making sure that maybe we'd have fewer staff out, and that's not just for COVID purposes. I mean, for illness, because most of the reasons why our staff are out is not necessarily due to COVID. There are other illnesses and reasons out there. And so we do know that last year, very few people actually had as many, sick experiences when there was some masking. Just some interesting bits of information there. But that's the type of data that we would collect and report back out. I mean, we've always said we wanted to make decisions based upon data. So, I understand that, we've just come back. We met a couple weeks ago just before the break, and we didn't make any changes then. I felt that we needed to look at a little bit more at some of the questions and the information, because I know that we had conversations about, well, I represent my constituency here, I represent my constituency over here, and so forth. And I would say that we have we always need to think about a broader definition of word constituency, but that's my own thoughts. But I wanted to show that within those graphs, there was a lot, like there's evenness within everyone here's constituency. And so for at least the people who responded, but I would venture to say the people who responded were the ones who wanted to respond to that type of survey. But it wasn't swung completely in one direction. We can't say that one town, for instance, says, oh, we want to do it this way, and one town says we want to do it this way. They're both fairly blended, was my point in showing that. And I thought that was interesting, because it wasn't what I had thought.
All right. Well, I guess, I'm sitting here thinking about, what was presented tonight, and I'm also thinking about, the numbers that came across today, and thinking also about the holiday and the things I've been hearing on the news in terms of anticipated trends after the holidays. And I tended to agree that principals have the authority to require it. But I also appreciate that they've got a lot of other things on their plate. And, I think if we as a board can help them with this decision, then we should do that. I also am very concerned about the numbers of staff that are out, whether it's because they have it, their family has it, or that it's something else. But the number of staff that's out is concerning. And the education that our students are not getting as a result of that is concerning. So last time when we talked about this, I was in the let principals do, but I also know that the having that power of decision making is it's heavy. Having experienced some of that kind of thing myself over the holidays and the heaviness it brings. I'm tending more towards the take a month and mask and look and see if we see any trends in any direction, up or down. Charlie.
You mentioned the numbers you saw today. What were those numbers that you saw today?
The numbers that came from Reuben, around 36 students.
Well, 36 individuals.
Individuals, pardon me, individuals, not students.
6 of staff.
6 of them were staff. So what we normally had been seeing as like an across the district is what was like in one school.
Well, that was across the 4 schools.
Yes, I understand that, but prior to that, we were seeing maybe maxing out at 8 students across the district, or 8, not students, 8 people, school community people out, and today it was 36. So we're talking 4 times what the general trend had been. That's what I'm saying. Is that accurate, you would say?
Oh, it's definitely 4 times and a 1 time. I mean, I think, yeah. I mean, there's some accuracy to it. You know what I heard Patty say and Lisa say is that there's underreporting. There's no question that when you have more home tests being done, less reporting is happening. So there's more illness taking place than we're aware of. So you're talking about that. Those are numbers that we know of. I also have the data, and I don't share this data ever because we'd just be sharing data all day long with the number of kids that were sent home due to illness that are getting tested right now. So it's who have the same symptoms. So we don't know that they're positive. They're not confirmed. My guess is that this week will, regardless of masking or not this week, just because it's going to be a carryover from what we would have expected. I would expect that we're gonna, you're gonna hear a lot from me about positive COVID cases. The idea is that in that second, in that third, and that 4th week in January is that we would see that decrease. And if we saw, I'd like to be able to compare November and December, for instance, to January and see if we had a clear trend. And if we don't, yeah.
No, I'm just saying, I don't think that you're going to see that trend downward really until the 3rd and 4th week, because I think it's still going to go up the first couple of weeks, given the holiday.
It could.
Anyway.
But to your point, if that's the case, then we're in big trouble, because our like I said, that means we're gonna have significant difficulties staffing beyond where we're at. If it is going to do that, I hope that that's not the case.
Right.
So my understanding was that we were anticipating an increased number of cases after the holidays because of people getting together during the holidays, not going to school, but getting together during the holidays. Okay. So if what we're trying to do is mask an entire population, what are we going to do when they're not in school?
Well, we can't control when they're not in school, but when they're in school, if they're masked, they'll be
But-
less likely to transmit.
But what we were saying was we expected a greater transmission when they're not in school. Correct?
Yeah.
That's what we said. There was a greater risk of transmission when they're not in school. So we anticipated a higher
Yeah.
load would come in.
No,
You know, I guess the real thing that I'm having difficulty with is I think that the parents do not want to put their kids at risk. I think that nobody knows the kids better than the parents. Nobody loves them more than the parents. And I think that they do not want to put their children at risk. And the ones who don't want to put their children at risk are saying mask. And the ones who saying, I'm not putting my child at risk, all you're doing is creating an issue for my child. All right, so why are you masking them? And so I'm kind of at the point where I believe that the parents should have as much say in this thing as we do. It shouldn't be my philosophy that I want to mask. Right? It should be the parents. I mean, I'm elected here by the parents to provide an education for their children. And I know that they're not going to get an education if they go remote. And I know they're not going to get an education if they stay home because they don't want to wear a mask, or they stay home because they want to wear a mask. And I can't please everybody. But what I do want to do is say that I believe the parents are being honest. And when I look at the survey results, I see that there's as much or as many who say, don't do it, as there are who say, do more. So I'm at the spot where if we have something that could prove to me that it's better off going to a full masking for a month than it is not to, then fine, I'll go for it. But I don't see anything that tells me that yet. That's just
Okay.
my position. That's, sorry, but that's.
No,
where
no,
I'm at.
that's, no, sorry, that's very good thinking.
Ruben, I have a question.
Sure.
So you shared the student illness data that you reported earlier today. And we should have a good sense of the transition within the community. So I guess I'm curious, where does that put us within our matrix?
RMS is at a little over 10% today, and the rest are around 8 to 9%. I'd have to go check that out, but if I believe I checked it before I sent anything out to make sure that nothing had changed from our yellow standpoint.
So with the data we have, we are still in the yellow across the
But that's,
district.
but 8 and 10% is consistent with what it was before with the holiday break.
Well, in some ways, we do have the data that we've been talking about not having. Because we have both the student illness data that Ruben reported earlier today, along with the transmission within the town. And I agree, it probably is lower, but we can't guess. We'd be here all night trying to make that information up. So, I mean, we have the data. We've been making decisions based on that this whole year. I guess I don't understand why we would deviate from that at this point. There's no fix. There's no overall fix.
There's no what?
There's nothing we can do to fix this perfectly. Except just trying to make the best decisions with the most current information that we have.
The current information I have is I don't see the numbers different now than they were before the holidays And at that point in time, we had the same framework that we have right now.
Great.
Can I don't know if, can you hear me?
Yep, go ahead.
This is Lisa. Okay, and actually a question just popped up in the chat that I was just gonna ask. What percentage of staff per school were out today?
I don't have that exact information right in front of me. But it was enough that in the secondary level, teachers had to cover other teachers' classes, which is typical. I mean, that's almost on a regular basis. I just know that we're at the max of being able to do that. And so we're close to the tipping point is my point, if we're not at the tipping point. And the elementary schools, I believe, had more out today. You know, not, once again, not all COVID related. So, and you know, even because of the subs shortage in the everywhere, let's say you have 2 or 3 out at the elementary school, you know, that can be quite a bit, because you're having to replace someone for a whole day situation. Well, it depends on who it is, but because they have different roles. But if a regular classroom teacher, you'd be replacing that person for the entire day. Tougher to do.
So correct me if I'm wrong, but aren't most of the teachers wearing masks? Aren't they vaccinated? And or how many of them are wearing N95 masks?
You know, and I don't have that information about how many are wearing N95 masks. I do know that the original vaccination rate was very high, and that when I go around to the schools, that the majority are wearing masks in school throughout the day. Teachers wise, I don't know if I've seen anyone not wear a mask throughout the day.
So
Christine. But in the survey, it was the teachers. I think 74% of them said they wanted a temporary or permanent change.
correct.
Right, because the mask that the students wear protect the teachers, right? So even if the teachers aren't getting sick, if they're testing positive, they're out for 2 weeks. So if the kid's wearing a mask and that prevents the teacher from getting sick, then the teacher can stay in the classroom longer. I presume that's why 74% want the change is, I mean, it's a presumption. But they're clearly stating they want to change.
I would agree with that. I would agree with that if there was some way of collating that, because teachers are adults and they go do things that adults do. They go to grocery stores, they go to different places, they talk to friends and family, and they also have family that goes to school or family that goes out, and now the family can come home sick, just like the students do. So, you know, I don't know that there's a correlation between whether or not the students wear masks and whether or not the teachers get sick. I would think that the correlation would be if teachers are going to get sick from kids not wearing masks, then students are going to get sick from kids not wearing masks as well.
Right.
As a matter of fact, the students are more likely because they're in closer proximity. So if we were to see the student sickness rates rise, all right, then I would say that, yes, there's a good reason to make the case for masking. But I'm not seeing that. I'm seeing the same number that we had before the.
I understand what you're saying. I mean, people are getting more sick outside of school than they are getting sick inside school. But if our teachers continue to get sick, then we're gonna have to flip the switch to remote because we won't be able to teach.
Or just close.
Or just close. We have less wiggle room with the staff. We can, if we want to wait until students, 20% of students are sick, that's, I hate to say that word, positive. That's one thing, not a good thing, but it's one thing. But we don't have that wiggle room with staff as far as I can see, and this is what Ruben's telling us. We don't even have the substitutes.
So if the argument is that we need to go to full mandated masks because of staffing issues, then let's make that argument. That's not the argument that I'm hearing.
I guess I
Sorry.
thought that was part of the argument, but go ahead, John.
I think it's a tough situation that we're all in.
Yeah.
A lot of data out there. Some of it is not very useful. And there's some data that is useful or that seems useful. Although sometimes we find out a month later that what we thought was useful last month, that really wasn't the right data. So, I voted for this motion last time we met 2 weeks ago. I'll vote for it again today. My reasons are the staff concerns. The data does seem to be fairly clear that we're on the uprise with infections. There's been mention about the home tests and how many people are using them. There's a lot of people using them apparently. I think something that Lisa said when she introduced the motion tonight, I would agree with. I think we should do everything that we can within reason. And I'm going to add 2 more points. One is that I spoke with a number of teachers last year when students were in school 4 days a week, and there was universal masking. And the teachers I talked to told me that it was going really well. That students hadn't liked it in the beginning, but they ended up being just fine with it. And there was a policy in place where students could take breaks. Teachers I talked to told me that most of the time, they never took breaks. If the class was interesting, they just kept going. Nobody asked for it. It was never denied, but that was not a concern. So that's one point I'd just like to offer. And the other thing I just would like to mention, something Ruben said about only those who responded to the survey are most likely those who are interested. My experience is that that's rarely the case. That you have lots of people who are interested in, very interested. You have a lot of other people who just assume that the administration, the board, that they're doing their job. And they're too busy trying to take care of their everyday life to go on and do surveys. Some of them don't even like going on the computer when they're home at night. And so I saw quite a bit in my professional career that surveys would be sent out and you'd get a response or no response, and everybody would think everything's fine. And you'd find out, no, people really cared about stuff. Just because they didn't respond to a survey didn't mean that they weren't interested. So I offer that, Ruben, just as, let's say, a counterpoint to the assumption. And I'd say the same about the assumption that students are more exposed outside of school. That may be true. It's not intuitive to me, though, that it is. Kids get together in classrooms. Our class sizes are fairly high this year, I hear. And, some of them go off after school and go to sports teams. So maybe they're more exposed, but a lot of them don't. A lot of them are going home, going off to whatever their normal activity is. So I would not assume that they're more exposed outside of school. And those are just my thoughts.
All right, thanks, John. So I want to just check in again with Lisa and Patty and see if you have anything further you would like to comment before we take this to a vote.
No. No.
That was Pat. Okay, both nope. Okay. And here, we're ready for vote? Okay. So I just want to recap. Basically, Lisa, correct me if I'm wrong, what you're suggesting, what the motion is basically 2A. Masking for the month of January, collect data and see if we should continue into February, correct?
That is correct.
Okay. All right, so that's the motion. John seconded it. I'm taking a vote. Patty?
Aye.
Thank you. Lisa?
Aye.
Thank you. John?
Aye.
Thank you. Christine?
Yes.
Thank you. Charlie?
No,
Thank you. Alicia?
No.
Thank you. And I say yes. So that passes 5-2.
What about depression rates? You guys take responsibility for that? Those are gonna skyrocket. Kids get sick. Our rates before COVID, I bet you they're very similar.
All right, we're moving on to the consent agenda. We had an addition.
Can I
Yes.
just clarify something that was voted? It would be
Yes.
hard, it would be hard to enact it immediately. So do we have a date that we want to
Date?
start that?
When you say it's hard to enact it immediately, you mean tomorrow. So are you saying what, Wednesday would be easier, Thursday?
Well, the board, I mean, I'm fine with starting tomorrow if you want. I mean, we're gonna have to get that, I'm gonna need to be popping in, communication out immediately.
Yeah, I'm sorry. I really think it needs to be immediately. I don't see that. I think people are kind of used to having a school board meeting and getting messages right after. I don't think that's anything unusual during COVID, especially. No, and the schools all have masks available. They have plenty of masks right there. So this isn't something people have to go out and buy masks for. They're all right there. So.
So, John?
Yeah, I would just like to say that yeah, I think Lisa's right, but I also respect Ruben asking the question. It's not going to be easy, Ruben, I imagine. And there's going to be issues not only of trying to communicate, but you're going to have compliance issues. And I know, because I've watched the way you and your principals work, that you do the best you can to deal with these difficult situations. So anything we can do to help.
Oh, just as we're moving, I'm going to be crafting some communication is my point. I would just want to make sure I'm not going to wait till after the school board meeting to do this. I'm going to be doing this as we are.
Yes.
Yeah, exactly. Yeah. And the reason why I asked was because we talked about making sure people had enough last time, making the importance of making sure people had enough knowledge ahead of time. That was the reasoning. That's why I was asking the question. So I'll just make sure that I get this communication out as we're talking.
All right, thank you. So the consent agenda, we had an addition of a resignation effective June 30th. Also, I think there's some minutes that need
Yes,
pulled.
I need to pull out minutes for December 20th.
Okay. Nick, did you hear that? December 20th? Okay. All right, so the consent agenda has the addition of the resignation and minutes for December 20th have been pulled. I need a motion.
make a motion to approve the consent agenda as amended.
Thank you, Charlie.
And
John, you second that. Thank you very much. Patty?
Yes.
Thank you. Lisa?
Aye.
Thank you, John.
Aye.
Thank you, Christine.
Yes.
Thank you, Charlie.
Yes.
Thank you, Alicia.
Yes.
Thank you. I say aye. That passes 700. Now the December 20th public and non-public. I need a motion.
A motion to approve the December 20 public and non-public minutes.
Thank you, Charlie. I need a second.
Second, Ms. Patty.
Patty, thank you. Patty, what do you say?
I say yeah.
Thank you. Lisa?
Yes.
Thank you. John?
Yes.
Thank you. Christine?
Yes.
Thank you. Charlie?
Aye.
Thank you. Alicia?
Abstain.
Abstain. And I say aye. So that passes 601. Okay, we're on to the discussion of the budget. So there's not a link to the budget finalization.
Yeah, I didn't necessarily have anything to provide
Okay.
that was given to me. One thing I could do is at
It's
least put
under,
the,
it's under warrant articles.
yeah, I could at least put the warrant article up that
Okay.
reflects the current.
Okay.
So this at least gives the numbers that were given to me as of I think about 2 or 3 hours before the meeting.
Okay. Discussion versus on the warrant articles is there. This is a draft, so they can be tweaked, so.
And as a reminder, we do have Carrie Broderick and well, I guess for this one it would be Carrie. We do have Carrie
Carrie and John, right?
ready in the event that we do need questions answered.
Right.
So
Good job, Carrie.
Yep.
This reflects what we agreed to previously, so.
Yeah.
It is what it is.
So I know Carrie was trying to get some language or to make it, send it through legal. I assume that this is the result of that. Because wasn't there an email that went out earlier saying that she was waiting to hear back, but there was at least some draft? I just wonder if this is results from that feedback.
I guess I can put Carrie on just to answer that question.
Yeah, that'd be great if you would. Thank you.
There we go. All right, you should be able to speak now, Carrie.
Okay, can you hear me?
Yep. Hi, Carrie.
Okay, good. Hi. So the legal language I was waiting for had to do with the lease warrant articles,
Okay,
and
okay, yep.
those are listed in this draft. However, I will still need to send this to legal counsel for a final review along with the DRA before next Thursday's budget hearing. So some of the language, the words might need to be tweaked a little bit. And I
Okay.
did want to comment on the 2 lease warrant articles that were drafted for the dollar amount. The amounts per year are estimated at a 3% interest rate for right now. So I estimated a little high to make sure that we had enough in the budget. I was hoping to hear back from the leasing company today to confirm where the rates are at the moment, but unfortunately I wasn't able to get information in time for the meeting. I'm sure it's because of the holidays. So it is a little bit on the higher side to make sure that there's enough in the budget to cover those first payments.
Okay. All right. Does anyone else have a question for Carrie while she's on?
Once you get the new numbers, will you plug in those numbers?
If they change, yes, I can modify them. And they may not change if the board wants to just leave it at 3%. And the only issue I would see is if for some reason there was a concern that they might be higher than that. But for the 15-year rates that I'd been provided before, I believe it was at 2.22%. So.
Right. Okay. All right. John, you have a question for Carrie?
Yeah, I was just wondering, where can we find this, these amended warrant articles, Karen?
On the webpage, I think.
That would probably be more of a me question. I had received them a couple hours before the start of this meeting. They'll be updated on the website tomorrow.
Okay, great, thank you.
All right.
There's a link to the agenda, John.
Is it?
Yeah.
Yeah, tonight's agenda has a link, but
Yeah, and it is currently linked. If
and
you
it
go to
will also
tonight's
be on the
agenda, it's right
website.
here.
Okay.
For the budget stuff. So.
Yeah. So also there's the intent of having the windows and doors, the work completed using the building maintenance trust fund. So I plugged in $500,000. I'm not sure if that's the amount that the board wanted to use. I know that John Leclerc is also on the call, so he can talk some more about the figures if you want him to discuss those figures. It could be that we use 500,000, and if we get some work done the first year and then we do another warrant article next year, or the board may decide that they want to increase that dollar amount.
Right. Why don't we put John on so he can just explain his rationale there?
Yeah, just a moment. All right, John, you should have the ability to talk at this point.
Okay, can everybody hear me okay?
Yes, we can.
Okay, which questions would you like me to address first? I mean, the dollar amounts or how it to be used or the timetable?
Well, I think if the article says the sum of 500,000 and that we're going to try and use that for the windows, I guess I'm curious, like, okay, so 500,000, how does that number, how'd you land there? What do you anticipate that would cover that?
Well, as far as the windows and doors go, my calculations between the two of them, the doors and the windows, we're talking somewhere around $1.1 million. That's today's prices. All these windows and doors do not have to be done right away. Obviously, there's some that are worse off than others. In fact, there's a couple of doors right now that can't wait, that I'm trying to use existing funds to fix those doors, but there's just a couple of those. I would, to me, if it's in the trust, I can do these in over the next 2 to 3 years, probably. We wouldn't have a problem in prioritize which windows and doors that should be done. If there's, for instance, $500,000 that is going to go in for next year, I would split that up between the doors and windows that really need to get done right away. They're not emergencies, but they're getting closer. The following year, if another $500,000 was put in, then again, we can address it, and we just about have everything done in 2 years for those windows and doors. I did not include everything because I don't think everything has to be replaced. For instance, the Conant windows don't have to be done right away. Those are aluminum windows, and other than replacing glass or something, the windows themselves don't have to be replaced right away. The middle school windows are very good. They still have several years more of life to them, except for maybe glass that fails. It's really the grade schools that have window problems, and all the schools have door problems, being ADA compliant and so forth, and just rust. So to me, the $500,000 into a trust is a lot better than just saying, okay, you have a warrant for 500,000, you got to do it all next year. Keep in mind that these prices are moving targets. Distributors will only keep and hold these prices for 30 days max. That's it, because they're changing constantly. It's just the way it is in the glass and aluminum business today. So I would say that out of that $1.2 million, $500,000 is a good number for this coming next year and the year after that to get all this stuff done in a 2 years time, and that would be okay.
Okay. Other questions or want explanations from John?
Yeah, my question is for Ruben and John. Can the budget cover ADA compliance?
Well, not the current budget, because none of these doors are, the windows, I don't have to really put into the budget right now because they're not as important as the ADA entrances. But the entrances, none of the doors and windows are in the current budget. So if we wanted to put it in the budget, the ADA doors, you're probably talking between $100,000 and $200,000 for all the schools. So it just, and I hate to take the chance if they don't pass, then I can't do anything. So it's really, I guess, up to you people whether or not you think it would pass, but we're talking a good $100,000, $200,000 to do just the ADA doors.
But John, that number is in the $500,000 for the building maintenance trust fund though, right?
Yeah, all that's in there, but if they wanted to pull that out and say, put it in the budget, we're talking, up to a couple $100,000. But if you put it in the trust, I would take it out of that trust and not have to worry about the budget.
Okay, so I just want to make sure that I understand. All right. That the funding for the ADA compliance is in the building maintenance trust warrant article. Correct?
Correct.
Okay. That's all I have.
Okay, anyone else? Patty or Lisa? Okay, thank you. All right. Thank you both, John and Carrie.
Anytime.
Now, did you want to sign warrant article presentations for the budget hearing? Or did you just do that with Carrie?
We should probably, that's what we've done in the past, isn't it? Is
Well, we've
sign,
done it for deliberative, but we've never
Right.
done it for budget. I
we
just
haven't
wondered-
done it for budget.
No, I just wonder whether you want to do it for budget or not.
Traditionally, it's
Just say it's just Ruben and Carrie.
Ruben and Carrie. And do you think there's a benefit in one of us working with that? At this point, as opposed to deliberative?
Well, the only advantage is that usually we don't have this many warrant articles.
Yes,
And if
that's
we have
true.
this many, if we have this many warrant articles, we're gonna have to divvy them up for deliberative anyway.
Right, so,
So you might as well
Practice.
get people started ahead of time.
right, good point. Okay. I like that.
Cool.
So looking at the warrant articles. So Article 1,
We don't need.
we don't need to do anything for.
Article 2 is usually gonna be Ruben.
Right.
Unless you
Article
want-
3,
unless you want to do it.
No? Collective bargaining, that would be at least one member of the
Yeah, I'll
negotiating team.
I'll do 3 and 4.
Okay, so Articles 3 and 4.
Yeah.
This is Lisa, can I interrupt for one moment, Marcia, on Article 4?
Sure.
Do we need to include that 0 for fiscal year 23-24? Or can we keep it as is 22-23?
Do you want me to answer that?
Sure.
Okay, so because there's 2 more years left to the contract, this is showing what the estimated changes would be for each year. So unless legal counsel tells me to drop it, this is typically how we present our warrant articles for any collective bargaining agreement warrant.
Great, thank you for explaining that.
Sure.
Okay.
I think it has to be Sanbornized.
Yeah. That's big. Yes, because there was a case, wasn't there, where it wasn't presented and they said they didn't know.
Right.
So now it has to be like that. Okay. So Article 5. That's the support staff one.
Article 5.
Yep.
We had some conversation. This is an interesting article in that it's we have a contract already, but this is about adjusting the contract. And so for this next year, the idea would be to adjust the contract by an additional $61,405 to increase some base salaries for several of our JRSSA covered employees, mostly in the area of clerical aides, custodians, and some instructional associate increases.
Right. So just checking, where it says fiscal year and it says 22-23, then underneath it says 23-24, and under the 24, it says 0. That line should just be eliminated, correct? Based on conversation earlier?
Yes.
Yeah, that would be fine.
Okay.
So we can make certain that would be eliminated. I mean, it doesn't, it's not changing anything having to do with the tax rate anyway, and I understand. Yep.
Yeah, but we want to make sure that it's just for that year.
Yes.
Yeah, okay. Does someone want to do that? Burning desire?
I'd be happy to do that, Marcia, Lisa.
Thank you, Lisa. All right, Article 6. And by the way, I know that it doesn't have to be just one person. If 2 people want to work on an article together to work on the presentation of it, that's fine.
6 goes with 5.
Right, so how about Lisa and another person? You want to work on that together?
Now, are you talking, because I end up missing a little bit of this. Are you talking about individuals who are going to present it for the budget hearing or for the deliberative session?
Both. That if they're start working with you and Carrie for budget, that they're more prepared for deliberative, have a deeper knowledge of it.
Okay.
Can
And have I
speak
been
to it.
volunteered for any of them yet?
Budget.
1 and 2, I think.
That's fine. Thank you.
Yeah. All right. So 5 and 6 go together.
I'm happy to work with Lisa on that.
All right, Christine, thank you. All right, so Article 7 and 8, those are both the lease ones. Yes.
So we'll be happy to work on those. And if somebody else would like to work on it with me, that would be welcome as well.
All right.
I don't mind helping, John.
Yeah, I'm just looking at those. They're both facility type things. But
I wasn't on the facilities committee, so I'll certainly be relying a lot on your knowledge of sort of some of the behind the scenes things, but I don't mind helping.
I would welcome your knowledge of how to present something so the general public.
Oh geez, I don't know if that's
Understands
my
it
skill set, but sure, I can do my best.
all right, and then Article 9.
I'll be happy to do number 9.
Okay. The capital, what,
Are we down to 10 yet?
Hmm?
Are we down to 10 yet?
10, yes, that's next. For the special ed. Yeah.
I mean, I could do that too while I'm up there.
Well, I was just gonna say, it's like my name is, oh, hey, we're getting a call. My name's not on here yet, is it? I was really working hard.
Always keep an eye on it.
So, Patty, would you like to do 9 and 10 collectively with me?
Yeah, I will.
All right. There we go. Okay, thank you. Okay. Next up, we have the CDC guidance.
Can I ask a quick question or make a quick comment on the
Sure.
warrant article?
Sure.
I think if I did my math correctly, I think, I could be wrong, but I think for Jaffrey residents, if all of the warrant articles were to pass, I think it's a collective $4.86. And that's not counting county and that's not counting the town. So that's about $1,100 on a, I mean, roughly, like using really round numbers, about $1,100 on a $225,000 appraised house. So I'm just, I think I know we're gonna do some really good, a really good job at that budget hearing and that deliberative session. I really think that all of these measures are important, but I think if people are starting to look at the fact that their taxes are going to go up on an average for that size house, which is pretty average in Jaffrey, about $100 a month, that they're going to have to build that into their family budget. And that's just the school part of the taxes. I think we're gonna face some opposition. Not that we haven't faced a lot of opposition for a lot of other things, so we're getting good at that. But I think our cases have got to be really strong, and I mean that in a good way. Like I think these things are worthy of the money. I just think that the pocketbooks are going to get stretched farther than they've been in many years. I have to applaud our staff and everyone who's been doing such a good job with the budgets in the past. And I don't blame this number on you. These are just facts. That's all I want to say.
All right, thank you, Patty. And I don't know, Carrie or Ruben, is her math pretty accurate in what she's saying?
Yes.
Okay.
That was good, Carrie.
Short, sweet.
Yeah. It is. This is it's a tough year in many ways, and we've cut back in the budget, and then the default budget is $300,000 to $400,000. I can't remember exactly what that is now below. And if that happens, we're going to have some difficulties. We know that that's going to be more staff cuts. And so, you know, and we have, yeah, we have articles that we absolutely need. We need that HVAC work, and Patty's right. We're going to have to explain to people why it's so necessary, and we're going to need to have these collective bargaining agreements passed, and there's reasons why that's necessary. It's the right thing to do, first of all, but yeah, it's necessary. And so I do think that it's going to take a lot of conversation, a lot of communication. And in the end, you know, it is a more difficult year than what we've had budget wise since I've been here.
Yes. All right. So we have the discussion. Sorry, we're done with that now, right? The warrant for now. Okay. We have down the CDC guidance and how they changed it. We've heard earlier tonight from the superintendent's report and in that discussion that the New Hampshire has not changed yet because they haven't got the full report. So I'm just wondering where people are at on that.
It feels like there's not anything that's worth discussing at this point without having any further direction that the state provides us.
Right. We've been taking our lead mostly from the state, and they've been taking theirs from CDC, but until. Okay. Anyone else think differently or just want to echo that?
I agree. And also, you know, right now the CDC guidelines around the 5-day quarantine are going to be difficult for us to implement. So maybe not rushing into that is a good idea.
All right. Thanks. John?
I certainly think we should expect something from the state and wait on that.
Okay. Charlie,
John.
comments? Yes, same. How about Patty or Lisa? Anything you want to echo or a point make?
Only that as soon as we can figure out a way to shorten the time that kids who are not showing any symptoms can be in school, that and accepting the negative test as quickly as possible, any of those things. I mean, I'm in favor of that because the amount of time that kids are out is becoming detrimental to their process. And
yep.
Yes.
And I agree with everybody. Let's wait on the guidance from the state and the complete guidance from the CDC. I definitely want, you know, kids back in school as early as possible. I just don't think that the schools are where this should be experimented on. And if this is an experiment the CDC is trying, there's other places that can certainly use that experiment. I think the school should be the last.
Okay. All right. I think we're all in agreement that at this point we're going to not change anything and wait. Hopefully by our next meeting, surely they will have that taken. Okay. Number 7, action item. This had been on an agenda and then it was pulled. So we're back with the Durant Fund. And Ruben, are you going to speak to this?
I believe I have David Dustin on here who might want to speak to it, but I also, before he does that, and if he is there, still hanging in there. Carrie, I think, had a conversation about the Durant Fund, maybe that we need to consider prior to any action taken.
Okay. All right. So David first.
Carrie first, actually, if possible.
Okay. Carrie first then.
Hi. So what
Hi,
I wanted
Carrie.
to mention, hi. As far as the different Durant Fund is concerned, we have the use of it is in support of the high school. So that's the intent of the Durant Fund. The amount that can be spent is for the interest income, so the principal can't be spent.
Right.
The amount of the interest income as of the end of November was $103,500, roughly, give or take a few dollars. I do not have the December statement at this point to determine whether or not the interest income amount is higher or lower than that. I will say that since July 1st of 2021, the amount has consistently gone down a few, $1,000 or $500 or so, except for 1 month. So I don't anticipate that the amount will be higher or much. I don't know that the amount's going to change that much, except for possibly going lower. So I would just caution the board on what they award. You can have a not to exceed amount, but it should only be for what's allowed to be spent.
Right. So in other words, the 115 exceeds what's there.
What's currently available to use, that's correct.
Right.
I have a question. Carrie, what is the percentage? What is the percentage that can be used? Is it 4%, 4.5%? That's typical.
It's not the percentages, it's the dollar amount that's actually the interest income dollar amount.
Right, but it's not 4% of the principal.
The principal, I want to say, is around 800. Let me see if I have the statement, the most recent statement.
Typically, endowments have a spending policy, and if the spending policy would say that you can expend up to 4% of the principal in a given year, or allow it to roll over into the corpus. So that's why I'm asking.
Right. So my understanding of this particular fund is that you can spend the interest income, that you can't spend the balance. From the documentation I've been able to pull on it in past years for the expenditures. So it's whatever the available balance is in that interest income.
Okay.
So it's not a percentage of the principal. So the principal as of the end of November was 870,000, roughly 500. And the interest income was what did I have it? 103,500. So wait a minute, I'm sorry. I looked at the wrong month. The wrong statement. It was 927,800 roughly for the principal, with 103,500 for the interest income. So the total for the fund is just over $1 million.
Okay. Okay, so we've got that. Do we want to now hear from David?
All right. David, you should have the ability to speak now.
Can you hear me?
Yes, we can.
Hi, thank you for letting me speak on this Durant Fund request. These are areas that we've been working on as a school that are part of the vision that we started crafting last year. So you'll notice the library, which is really a center of our school's learning environment, has quite a few areas that I had mentioned, the last time I addressed the board about increasing capacity for both learner seating, as well as replacing some dated furniture and expanding the shelving for our collection and things like that. And the flooring in there is on the list if possible. That's an area that we could remove and try to do at another point in time. But that was, we all had a bit of a scare this past summer with the mold that took place. And that was an area where the carpet became significantly saturated with mold. And obviously there's a major fear there about the health of our collection when you have mold in there and things like that. And the other areas, again, focusing on science, STEM, thinking of our art facility, where this year our art numbers are kind of through the roof, and we're seeing a need to expand capacity for ceramics and get that second smaller art studio sort of up to snuff. That's another major area of where we're asking for some funds. So I certainly hear what Gary's saying, and if the board can only approve up to a certain amount, we would certainly thank the board for that and adjust what we're able to spend this year based on what that would look like. And the numbers that we've put in here as estimates are based almost 100% on quotes that we obtained ahead of time. Not all of them. In some cases, it's hard to get a quote at this point. And obviously, this is an estimation because the quotes are changing, as with everything right now, pretty rapidly. But these are numbers that were based on, the submissions that we had gotten for the budget season this year.
All right. Questions for David? Christine?
I'm sorry, David, I'm not very hip. What are esports?
So that's actually a Heather Lindstad major focus area that fits nicely with our STEM STEAM sort of growth over time. Esports are like a video games, but it's competitive video games, and they're actually scholarships that can be earned by learners, and there's whole leagues that are built around this. So it's literally just like any other sort of athletic contest and how it's structured, set up, and the opportunities for learners, but it's all based around video gaming and things like that, sort of an up and coming area. So Heather has been looking to expand our activities and support more of our learners' interests with that. And it would take about $1,000 to get us up to being able to join those leagues.
Thank you.
You're welcome.
Others? Lisa or Patty?
I believe I have
I'll just say that yeah, I'm very excited at the uses of this money, having been a former librarian in that space. That's thrilling to me that you want to invest that into it, into the arts program, into esports. That field is heavily career-based, and there's a lot of scholarships you can get. That being part of the esports tournaments opens up a huge environment for these kids. So I'm excited at what you guys want to use this money for.
Thank you.
Thanks. Was Patty gonna say something?
No.
No? Okay. All right. So if we're going to allow this, there has to be a motion. And it has to relate to the actual amount available.
So I'll make a motion that we authorize expending from the Durant Trust Fund, the interest and income per David Dustin's request of $1220, not to exceed $103,500.
Okay, I want to check with Carrie because she said the actual interest had been going down, I think. But there's not going to change that. Carrie?
How do we say this?
Yes, I'm here. So
I just-
yes, the amount could actually be less once I receive the next statement. But if you say not to exceed, David just won't be able to utilize whatever the difference that amount is. Does that make sense?
I don't understand,
Were we
Carrie.
not exceeding?
Okay. Interest
Okay.
interest income is what we've earned to date. Is that correct?
It fluctuates monthly. So every month I get a new statement that states the
Is that an
interest
estimate?
earned, and then the management fees come out of the interest income. So the management fees have been exceeding the interest income that's earned every month.
So that's what's depleting the fund is the management fees.
If the interest earned does not exceed that amount, that's correct.
Okay,
So maybe not exceed 100? Would,
well, I would just add to that is not to exceed the
available
total amount of the available income interest.
and not put a number on it, just say that.
Yeah.
Yeah. Or how does that work? Legally, is that okay?
Well, we said not to exceed 103,500 or the amount that's in the fund.
Or, okay,
Yes, that would do it.
there we go. All right. Thank you for that motion, Charlie.
Second. Oh, go ahead, Alicia.
Alicia, second, thank you. All right, so all those in favor, let's see, Patty.
Aye.
Thank you, Lisa.
Aye.
Thank you, John.
Aye.
Thank you, Christine.
Yes.
Thank you, Charlie.
Aye.
Thank you, Alicia.
Yes.
Thank you. I say aye. That passes 700. Thank you, both Carrie and David.
Thank you.
Sure, thank you.
Okay, board committee updates. Let's start with facilities.
Nothing to update since our last meeting.
Okay, when is your next meeting? Do you know?
No, I don't.
Okay.
Well, typically we would meet the third Monday, but I'm gonna get in touch with John in the next couple of days and see if there's something we could do before that to begin preparing.
Okay, great. Thank you. I know that the education committee, we meet on, David, you still there?
Yes.
All right, is it the second Thursday?
I think so. I'm just double checking. I think that was the second Thursday. Sounds right.
So that we came before the third Monday, which is the second board meeting of the month. So that's when our next one is, and the topic is going to be, I never get this right, the initials, but the more social emotional aspects, yeah?
Yes, it's the multi-tiered systems of support for behavior. So it's MTSSB.
Thank you.
What time is that at?
And we'd meet at 4 o'clock. All right, policy.
We are planning to meet on our regularly scheduled day, which will be the 27th this month.
Okay. Thank you. Finance, is it this week? Charlie, do we meet this week?
No. What do I have here? We're not due this week anyway.
All right, when
Until
is
seventeenth.
it? When would we put it off to until
No, it's normally the third Thursday.
the third
at
Thursday?
1:30.
Okay,
And the finance committee, after we did the budget, has been taking a winter vacation. And our next meeting will be the third Thursday of the month.
okay, thank you. What am I missing?
Wellness
Wellness?
and communication. I think the wellness committee meets, I think, January 18th.
Okay. And communication, do you have a scheduled meeting?
We do not have a scheduled meeting at this time.
Okay. All right.
And
Next
I'll
up-
reach out to
oh.
schedule another goals one to go over where we are with all the goals that are going on right now and kind of an update, and to talk about where things need to adjust and where things need to be, pulled back, and then other things need to be sped up.
Okay, great. Okay, public comments?
All right, I'm just gonna put the public comment policy back up. Again, we do have both a physical and a digital audience. Just a quick reminder, make sure you are adhering to our policy. If you are remote, feel free to use the hand raise feature and we can acknowledge you that way. If you are in person, you can raise your hand physically and I can bring a microphone over to you.
Right.
And start with physical again, as we did
Yes.
before.
Sheila Nagel, Jaffrey resident, taxpayer, voter. I did vote for a lot of you who are sitting up in front of me right now. Some of you I did not. Even if I didn't, you guys were all voted into positions by taxpayers to do what we want, because you're voted in by us. And I think that a lot of you guys, I see it, you're torn because you weren't voted in to make health decisions. You were voted in to make budget decisions, education decisions, field trip decisions. And you are now starting to make decisions regarding masking. And I feel that you guys are letting your personal beliefs lead that. We have a matrix. We're not even near where we should be mandating masks. We're mandating them kind of from what it appears to me as no reason, because it was brought up to mask them to allow children to come back 5 days earlier if they tested positive with COVID, and we didn't do that. We're just masking them. I feel we're looking at things that don't really matter. Not saying that it doesn't matter, but if you're looking for the well-being of kids, you need to actually look at statistics. Look at what is the leading cause of death in New Hampshire for our school-age kids. Number 1, accidents. Number 2, suicide. COVID is nowhere even on the top 10 list of this list. You guys need to keep that in mind. And suicide has affected our community recently. We have had a teen commit suicide. My child, 2 of my kids actually wear a yellow ribbon on their sports uniforms because of that. I don't think you guys are looking at the big picture. It infuriates me as a parent. I don't know, did you guys even look at the numbers of where we were pre-COVID right after Christmas? How many kids were out with illness? Does any of you guys know that answer? I'm guessing by the blank stares it's no. We're at 8% right now. I'm guessing, I'm not a betting person, but if I was, that it's probably right around where we were pre-COVID. We don't have the flu. How many kids are out with the flu? They're out with COVID. It's replaced the flu. So we need to look at that. It's not going anywhere. Kids are going to get sick. It's terrible. I have 5 children. I hate it when my kids are sick. But at the same time, I'm really concerned about their emotional well-being. And I think I really hope that you guys would be concerned about their emotional well-being. So right now, if we, in the matrix, we're technically at yellow. That doesn't say that your child can't wear a mask. It just says that my child has a choice. And the mask isn't one way. That's silly to say that, oh, my mask only protects other people. No, if that's the case, you can flip it inside out and wear it the other way. Masks go 2 ways. If it's stopping things from going out and stopping things from coming in. I'm overly frustrated that we have a matrix. I think that was a point that the community came to an agreement because we have people on one extreme and people on the other. And it was an agreement. Everybody who doesn't want masks was saying, all right, well, if we do hit 20%, I'll tell my child they have to wear a mask. But I think this is getting a little bit silly. We're at 8%. I'm guessing it's pretty close to where it was pre-COVID. I don't think anybody looked at it. Has anybody also looked at the disciplines? Have you guys asked how many mask write-ups have we had? How many kids have served lunch detentions after schools, in schools due to mask violation? Have any of you guys asked for that information? John, you keep saying that it doesn't affect the kids. It does. Kids get written up. Kids have lunch detentions. Ask Carrie Drew. Her office is full of these mask people. It's just, my kids are some of them. Their mask will slip down, and if the teacher thinks they did it on purpose, they have a lunch detention. It's frustrating. As a parent, it's frustrating. Working in the school, it's frustrating. Writing kids up for it, it's frustrating. I wish you guys would stick with the matrix. We had an agreement. There was no reason to veer from it. 36 people over vacation had COVID, wasn't school related. I'm very overly frustrated, and I feel let down, especially for people who I voted for, because I don't feel you have the community's interest in mind. People who took that survey showed over half of them did not want to change or did not want any restrictions. So you didn't go with people who voted you in your position. I do appreciate everything you guys are doing, and I know it's not easy. I'm just angry.
All right, I'm just going to check the digital list at this point. We do have one person remotely.
Okay.
Jennifer Clark.
Hi, Jennifer Clark, Jaffrey. So during these meetings, my daughter creates a group chat where there are several of her junior friends who listen in onto the meeting through my computer. So I'm talking for a couple of.
Ooh, we lost you, Jennifer.
They are having issues with, okay, so the teachers are policing the students wearing their masks. The students know they're supposed to be wearing their masks, but who is watching over the teachers who don't wear their masks? Because these students are saying right now to me, they have several teachers that don't wear their masks inside of those classrooms. So who is running the check as far as the teachers? Because if the students are responsible to wear their masks, then the teachers need to be responsible to wear their masks as well.
Thank you, Jennifer. Any other hands raised?
I don't have a hands raised, but the point that's being brought up to me right now is somebody's trying to make a comment. They're not on a phone app. They've physically called in and they're having a hard time patching through. So I'm just trying to see if I can look something up to see if they're doing something wrong to chime in.
Okay. So why don't I go on to board matters and future items
Just give me a
and see
second,
if
I
that
can-
happens. So is there any board matters? Yes.
Yeah, there's one thing I'd just like to ask about, and I was hoping that Ruben might have some information. Someone sent me something today about House Bill 607, which is apparently a bill with the intent to expand the voucher program and the amount that it will cost. Specifically, that it will take away from school districts. And I don't know if that's a significant risk or whether that's just something that's out there but doesn't have much support. Ruben, do you have any information on that? Or?
So I'm pretty sure Ruben has talked about that it is a risk. If Ruben wants to address that.
Yeah, just one second. So definitely it's a risk. I'm looking for an email that I received earlier today stating that that conversation was going to be had in committee at least on the 5th, meaning Wednesday of this week, which was a little bit of a different time frame than what I was originally informed. I was informed that it would be having comments on it toward the end of the month. So I've actually started to look in to see the accuracy to this email that I received. It was from Special Education Association. Anyhow, I can't find it, but to answer your question more specifically, yeah, House Bill 607 poses some significant problems for communities. And while if you are an individual who likes choice and believes that you should be provided funds to send your children to private schools or private religious schools or other schools, perhaps other public schools maybe, then certainly is something that you'd be interested in, except that it does not actually decrease your taxes, it will increase your taxes because there are fixed costs at each school district level that you can't go beyond. We've been talking about the buildings alone cost an incredible amount, and you need to make sure we're budgeted for that. And most people who are taking the vouchers currently out there are not kids who were already in public school. They were already homeschooled or they were already going to a private school. So already money has been taken out of the normal stream to go to these other locations. I think without getting overly political about it, I can say with certainty that it will drive tax rates up. there's no question down the road, should 607 get through in its current form, so that there are, as it currently is, the system is that was pushed through this past year by signing of the budget, that you have to have a certain income, be in a certain income bracket at least, in order to access these funds. The 607 is saying, let's get rid of all that. And so it could open the floodgates, literally financially, for towns, because you know it's going to be paid on the backs of the local taxpayer. From an educator standpoint, I certainly have no real issue with the concept of choice and people choosing to go where they want to be educated. I do have difficulty matching up giving state and funds, state funds, local funds really, to individuals to go to schools that don't have accountability structures like the local public school does. So as we are having to assess our learners and report, behaviors and everything else, every year we have a whole slew of reports that we provide and that we're accountable for. These other schools that are receiving these funds aren't accountable to any of that and have free reign. And so with money should come some accountability. And I think that we can all agree on that statement in some fashion.
Ruben, is there a way that we as a board can provide, you said that they were taking comments regarding this HB 607?
So the school board could write a letter if it wanted to, and we could send that in. School board members could go to actually a location, well, if they're allowing it, a lot of these items are remote sometimes, but to go in and comment if you're able to, if you're allowed to. The other thing is to contact representatives. I don't know as though they're totally interested in hearing from superintendents. We all say very much the same thing, but people who are taxpayers, school board members, representatives of the community, it would be good to hear from, I think. I'll probably provide you more information tomorrow because I'm trying to find out the accuracy to the idea that they're going to be meeting on it on the 5th this week. It seems awfully fast. And if it is the case, I'm wondering if maybe it had been, pushed up. So, because like I said, the last time I knew it was later on in the month of January.
Right. So not a lot of time to collectively do anything, but individually.
Yeah.
Okay, thank you. Future items. Okay.
He's raising his hand. Nick?
Oh, Nick.
Yeah, so we have officially been able to get that person lined up in queue for public comments.
You
I
have.
guess a new discovery, because I've not had this experience or this brought to my attention before. So this is something I can now rope into our typical public comment section. So most people, even if they're calling or coming in via mobile device, they're accessing via the app so that they can still see what's going on.
Yes.
We do occasionally from time to time get a person that's just on a cell phone, some other
Yes.
type of phone. Obviously you can't push a hand raise button when you're doing that. So the code to be able to raise your hand in those appropriate times would be *9. By doing that, it allows your telephone to, again, let us know that we have a person that would like to speak on a telephone that's not hooked up to the Zoom app.
Right.
So again, we can start roping that in as an additional item.
Okay.
But so we do have that one last person that was trying to access and now theoretically should.
Yep. Well, let's take a minute and.
All right. So I'm going to push allow to talk now. And again, just first name, last name, town of residence, please.
Hello, can you hear me?
Yes.
Yes, we can.
Oh, Awesome, thank you. Sorry about all the confusion. My name is Paul O'Malley. I'm a Ringe resident. I was just trying to chime in on the whole mask mandate and everything that you guys are changing right now. I believe that you guys are going against the matrix that was voted on earlier this year. And I believe that we should be sticking to this matrix, and it's the parents' responsibilities to determine whether they want to increase or decrease any requirements for their specific child. And I believe that you guys are trying to take that into your own hands, and that you guys are violating our rights. And we voted you guys in to do the right thing and basically vote the way that the people that voted you in want you to vote. So in order for you guys to change anything, you guys should have to take a poll or take a mass vote to do such drastic things. But I appreciate everything you guys are trying to do and keep our children safe, which is very important. But right now, our school is not at a very high rate. I think we're at what, 9%, and the matrix calls out for 20%. So I think we should try and stick a little closer to the matrix instead of trying to change these. Our kids need to get accustomed to getting these germs and normal things so they can build an immune system. And by trying to force them to wear these masks, you're compromising their futures. But anyway, I appreciate you guys taking the time to listen to me, and have a nice night.
Thank you, Paul.
Thanks.
Okay. I'll take a motion for adjournment.
I'll make that motion.
Thank you, Alicia.
Second.
Okay, thank you, Patty. And with that, we're adjourned.